So today we'll talk about gout. Gout is one of the most common form of arthritis which we see in our clinic, and it affects both males and females. It affects mainly women after menopause, and in terms of men, it affects men independent from their age. We have actually young males with gout and old males with gout. So what is gout? So gout is a form of arthritis which is caused by elevated levels of uric acid. When uric acid reaches critical concentration, it forms crystals, and crystals are deposited in various joints, causing inflammation, pain, and swelling of the affected joints. What do we need to know about uric acid? So uric acid is produced in liver mainly. The main enzyme which is responsible for production of uric acid called xanthine oxidase, and most of the drugs available on market right now specifically targeting this enzyme. Elimination of uric acid is mediated mainly through kidneys. Approximately 60 to 70% of uric acid produced in our body is eliminated through kidneys, and the rest through the gastrointestinal tract. So we're talking about 30 to 40%. There's an enzyme which can also participate in degradation of uric acid, and it has a long name. So it's called hypoxanthine guanine phosphoribosyl transferase, and there is an abbreviation for that enzyme. It's called HGPRT. So this is a critical enzyme which is kind of opposite to xanthine oxidase, and this enzyme lowers the level of uric acid. At this point, there are not too many drugs available to control these enzymes, but there are quite a few supplements available. So what is interesting that genetically in males, activity of this particular enzyme is much lower than in female, and it's one of the reasons why young males have much more problem with gout than young women. When we're dealing with gout, there are two issues which we need to discuss. Issue number one, how do we deal with acute gout attacks when a person or patient is in severe pain? And number two, how do we control uric acid level from being elevated, and how we can prevent the development of crystals, and how we can prevent flare-ups of gout. We're not going to talk about medications, because you can find plenty of information on internet and in various publications. But today we'll talk mainly about a natural way of dealing with gout. Actually, the number of natural supplements available for gout is much more than a number of drugs available for gout. So if a person or patient has an acute gout attack, so what do? We're using herbs and supplements which have strong anti-inflammatory activity. For example, in our clinic, we're using a very popular herb. It's called devil's claw. In addition, we're using an herb from Amazonian rainforest from Peru. It's called iparuru. Also, we're using boswellia and curcumin for the same reason. And in addition, what's been shown is that high dose fish oil combined with methylfolate and alpha-lipoic acid can significantly reduce an acute inflammatory reaction caused or triggered by uric acid crystals. This next step is prevention of gout attacks or maintenance of gout. So how do we handle it? So there are several natural remedies which are very efficient. Number one is a white Chinese mulberry extract known as Morus albus. So this particular product has a chemically defined ingredient which is called maurine, and maurine is a natural inhibitor of xanthine oxidase. It also stimulates elimination of uric acid through kidneys, so it has double beneficial effect. So maurine is found both in roots and in fruits of Chinese mulberry, and we carry in stock highly concentrated fruit extract. The next product is alpha-lipoic acid. So alpha-lipoic acid has a unique property. So alpha-lipoic acid actually stimulates degradation of uric acid and can be combined with white Chinese mulberry extract as very powerful combination. So in order to speed up the elimination of uric acid through gastrointestinal tract, we're utilizing yucca root extract, which is known as Yucca shigera. And this product works as a soap, so it kind of washes out uric acid from the gastrointestinal tract. In addition, we have a brand product called liver detoxifier, which eliminates uric acid through liver via increased elimination with bile and then through gastrointestinal tract. Finally, two oils, black currant seed oil and krill oil, can significantly reduce production of uric acid in the liver and also benefit patients who are trying to lower uric acid.